Covid-19 in Scotland, the impact on unpaid carers and carer service support workers. The pandemic has had a huge impact on Scotland's unpaid carers. An unpaid carer is anyone who cares unpaid for a friend or family member who, due to illness, disability, a mental health problem, or an addiction, can't cope without their support. Over the last year alone, unpaid carers have spent on average 90% more time caring for loved ones. There are many reasons for this, but nearly half of unpaid carers said it was because the needs of the person they care for had increased. This has had an impact on the physical and mental health of unpaid carers. 84% say their mental health is worse than before the pandemic, and 67% say their physical health is worse. 91% are more stressed than usual, 90% are more tired, 79% are more lonely or isolated, and 88% are more anxious or worried. Some of these difficult feelings and experiences can be explained by a lack of opportunities for respite. Access to formal breaks, as well as hobbies and informal socialising, have been restricted throughout the pandemic. 82% said they'd had no access to respite or breaks since March 2020. Many support options for unpaid carers moved online. For some, it has been easier to access support because they don't have to leave the person they care for to connect with others. But not everyone has the private space to take calls, and many carers are missing the opportunity to meet in person and spend time with others who share their circumstances. Some unpaid carers have been able to enjoy more time at home with family and friends, but over half said that the pandemic has had no positive impact on their lives. Of course, the pandemic has also impacted carer support workers. The challenges that unpaid carers face has created new barriers to supporting them. Among these barriers, 89% of carer support workers selected carers not having access to IT. 89% selected a lack of respite options, and 82% said statutory services being closed or unavailable was a challenge. For 65% of carer support workers, the challenges presented by the pandemic changed their role. Support had to be delivered in a new way, and many had to deal with more emotionally demanding calls from unpaid carers, but without the usual support of their colleagues. Many said their workload had increased and say they are working beyond their contracted hours. This is all while they are facing their own personal and professional challenges brought by the pandemic. Home working can be difficult for carer support workers who don't have private spaces, and nearly half said it was difficult to keep home and work life separate. However, over half agreed that home working gave more flexibility, and remote working allowed connection with some carers who wouldn't otherwise be able to participate. The road out of the pandemic is uncertain, with unpaid carers and carer support workers alike concerned about the future of support. How will remote working impact on the future of support? What will be the long-lasting impacts on COVID on unpaid carers and carer services? How can services transition back to a pre-pandemic model of delivery? To find out more about the research and to check out the recommendations and suggestions to support carer services, visit the full report on our website, www.carers.org.